course, upon meeting your patient, you have to greet your patient, introduce yourself, and also explain the procedure, because you will have to make sure that the patient is comfortable with your presence, and that she will not be worried, and she has a proper understanding of what you will be giving and why you are giving these medications. And you also have to identify, of course, your patient to make sure that you will be administering the medications to the correct patient. So say for example, I have here an adult. Okay, let's assume that this is an adult patient, okay, that I will be administering the medications to. So, ma'am, good morning, ma'am. My name is Charity Hopal. I will be your nurse for 8 hours from 8 a.m. until 4 p.m. ma'am. Just to confirm, may I have your name, please? May I have your name? What's your name? Complete. Thank you very much. Also, we can check the ID band on the wrist of the patient to make sure that she is the correct patient. Ma'am, I am here actually to give you some medications. I have here your vaccination. So I will be giving this one here on your arm area. And also, we will be doing some skin testing for your antibiotic to make sure that the antibiotic that we will be giving you tomorrow will actually not cause any allergic reactions to you. And we also have here your subcutaneous injection for your insulin for your sugar, mom, to regulate your blood sugar. Okay, ma'am. Okay. Next is we will put the patient in a comfortable position, because we want to make sure that she is comfortable and to lessen actually the anxiety on behalf of the patient. So, ma'am, sit comfortably. Okay. So first is I will be giving the intradermal, or which is, for example, for our skin testing. So again, the best set is actually the inner aspect or the inner forearm of the patient, this one. So what we do is actually we look for the best site, the one that has no lesions, moles, what else, veins, redness, rashes, nothing. So this site should be smooth and clear. You do not want those things to actually hinder or to actually give us inaccurate results. Alright, so for example, what I have here is this area, for example, just for example, this area here. Okay, so we will get a wet cotton ball and then wipe the area to be injected on in a circular motion from inner to outside, one direction only. So like this, do this, there you go, and then discard. If you want to do it again, there you go, discard. Okay, and then we let it to air dry. So here's the medication. So I just would like to discuss to you, okay, the bevel or the slanting portion of the needle. So when we administer an intradermal injection, it should be bevel up, because we would want to have the medication formed a wheel on the intradermal aspect of the skin. So we do this like this. Okay. This is bevel up. Alright. And then we hold it like this, because again we will be having a 10 to 15 degree angle, so it's almost flat to the skin. Okay, and then while holding the patient's arm, touting, we do it like this. There you go, almost flat. Okay, and then you will just do that. Okay, just beneath the skin, intradermal. Okay. Okay, so once you do that, okay, so for the safety, we will not be using a needle. I will be using a different needle. Different syringe. Alright. So for example, this one, and then bevel up. You will do this. Okay. Once the needle is inserted, about 1/4 inch of the needle is inside the intradermal. Okay, you will use your thumb here that you use in touting, so you will release the tout, and then use this thumb in holding this one. Okay, almost tip of the syringe, and then your dominant hand will actually push the plunger. You will push it until you're able to form a wheel. Okay, about 1 cc of wheel. Okay, after which, okay, you will get a dry cotton ball to just wipe the excess medication that goes out of the skin. So just wipe it. Do not massage or do not rub, because that would actually hinder in the accuracy of our skin. And then once done, okay, you will mark the wheel. For example, we have a wheel here, so you will mark the circled wheel. Okay, and then write the medication. So for example, we have here penicillin. Okay, you will label penicillin, and then the date. Okay, so that is 7 and then the time, for example, it's the time due. So usually for skin testing, we check it back after 30 minutes. So I'll write time due is 8:30. Okay, so I will be checking this back after 30. The purpose of this wheel or the wheel or the mark that we do here is this will be our indication if the patient has an allergy. If after 30 minutes the wheel goes beyond the mark that we did, that means that the patient manifested a hypersensitivity to that certain medication. In that case, you will have to notify the physician so that he can give an alternative medicine in that case. Alright, so ma'am, again, instruct the patient on what to expect and what to not do. Ma'am, I will check this back at 8:30 a.m. Do not rub the area. Do not press on the area. If you feel any itchiness, do not scratch it. Just tell me if you feel any itchiness or warmth or if there is any redness. Okay. Okay. What we will be doing is the intramuscular area. So here, 3 finger breaths, assuming that we want to assume that this is an adult patient. So for an adult patient, that is actually 3 finger breaths, okay, from the acromion process. So but the bony prominence is here. So 3 finger breaths like that. This one is our target. For a child, 2 finger breaths from the bony prominence. Okay, and this will be our target. So 2 finger breaths only for a child, because they have a shorter and smaller deltoid area. So we want to hit the exact location. So again, assuming this is an adult patient, we use 3. This one. This is our target area. So we wipe it with our wet cotton ball. Okay, again. Okay, what we do is a circular motion from inner to outer, one direction only, because we want to disinfect the area. At the same time, we want to avoid from recontaminating the already cleaned or clean area. So 1, there you go. So if you need to again clean this one, so you discard your cotton ball and then get another one and then wipe. There you go. Okay, so this one is your area here, and then what you do is you pinch this one, okay, because again you will be hitting, we want to hit the muscular area. So get your this one, okay, but before that you can actually do is you get your cotton balls, dry cotton balls, put it here, and then your micropore. Okay. This would actually be used after injecting. So we want to cover the punctured area. That way. So we do that. Okay. Some would actually do this. Okay, like that, and some that I actually prepare this one. So again, like that, we had it let air dry. Okay, we get our medication using a one-hand technique. Open, okay, and then hold it like a dart. For this intramuscular area or intramuscular injection, we do it at 90 degrees. So at 90 degrees, we mean straight. Okay, and then we do it straight, and then for this size of the needle, we inject it fully. Okay, for safety purposes, I will not be using the syringe or with a needle. I will use this one instead. Okay, you pinch this area. Alright, ma'am, I will be injecting. This will just be really quick. Okay, you will feel a little discomfort, but tolerable. Okay, and then you will have to inject fast. Okay, punch it fast, because that would actually cause lesser trauma and less hurtful on the patient compared to injecting fast. But once you injected, you have to introduce the medication within 10 seconds. Not too fast, not too slow, because too fast introduction of the medication would actually cause discomfort on the patient. So let's just do it moderately. Okay, you do it like that, and then you want to aspirate just a little bit. Okay, you want to make sure that you are not hitting a blood vessel. Okay, if you see a blood coming through the syringe, it means you are aspirating or you are hitting a blood vessel. So you have to remove, for example, it happened, so you have to remove and then prepare another medication, prepare a new one. Okay, and then look for a different site, so go on the other arm. Okay, but for example, okay, let's say that is not the case. So again, we'll do like this. Okay, you pinch like that to give you a better access on the muscular area, and pinching would actually sort of lock the medication once you introduce it. So you do the dart technique, you do it like that, aspirate. Okay, you can also hold this one, thumb and index, aspirate, no blood, and then pinch again a little bit, and then introduce the medication. Alright, once done, okay, you get your cotton balls, okay, and then remove, put the pressure, okay, do that. Mom, can you hold this one? Your patient to put a pressure, but instruct not to massage the area. Mom, do not massage. Let's have the subcutaneous. For the subcutaneous, actually, it's normally, especially in insulin, it's normally done on the abdomen area. But you can also use this, you can also do the subcutaneous on the deltoid area. So the only difference is the angle and the way you inject the medication. So for the subcutaneous, it's only 45 degrees, so half angle that of the intramuscular or the IM. So if the IM is this one, 90 degree, the subcutaneous would be 45 degrees, so like that. And you do not insert the whole needle, so just halfway through, because we want to make sure that we will be going on the fatty area and not the intramuscular. Okay. Again, for safety purposes, we'll be using a needless syringe. Okay, so ma'am, let's go on the other side, ma'am. Okay, so for example, this is the other side. Okay. This one is the other side. Again, same. Okay, you get your cotton ball. Okay, same location. Wipe and then discard. Okay, 45 angle. So you can do this technique. Okay, like that. This would be touching your patient, and then do it slantly like that. That would actually be already 45 degrees. Okay, so you do it like that. You insert the needle just only halfway through, and then you can already hold it this way, or you can actually just using this one. I will push, okay, the medication. So if you notice, I am not aspirating. Okay, we do not aspirate because it's a subcutaneous area, so there's no vascularity on that area, so no need to aspirate. Thank your patient, ma'am. Thank you very much for your cooperation, ma'am. So later on, I will just be back. We'll be checking your this one, your skin testing. Just in case you need some help, just notify me, or you can also just notify me so that I can help. After doing the procedure, of course, you go back to your area, you discard all the equipment that you have to discard. It's on the proper disposal bin. So your syringes, your needles would be on the sharps. Okay, your cotton balls would be on your infectious ways, and all among the others, your gauze and all that. And then of course you do your hand washing to prevent the spread of contamination, and you do the proper documentations, because we, especially that we gave a parenteral medication, so we have to properly document it. And then we have to still have an ongoing assessment with the patient to see how her body reacts with those medications. And don't forget, with the intradermal, you have to go back to the patient 30 minutes after and then check on the will if it goes beyond your marked area or not. And then you have to document again if there are any unusual reactions on the patient.